Lately, we've had a lot of people with fertility issues coming to us and asking us about LDN because they've either read about it or spoken to a friend who've tried it. And I think this is a really good thing, because where you have an issue that's hidden and we don't really know what's going on, LDN helps you figure it out. It helps your body, helps the fight. It's an amazing tool in your toolbox for subfertility, and it's definitely something people should consider. What are the type of patients that we see at the clinic for fertility issues? So as I said, one of the groups of people are people who are completely well, but they want to make sure that they have the best condition possible for implantation, to have a baby, and that is something that can absolutely be done. Another subset of patients are patients who are slightly older in age. They maybe decided to try a little bit later. By now, age is not really on their side, and usually this is, I would say, early 40s onwards. And there are things that can be done to make things the best, to make both parents the best host possible for the implantation to happen, for a baby to happen. Multiple miscarriages, that's another common one. If you have tried and you are able to get pregnant, but you cannot keep the pregnancy, this is something we can absolutely help patients with. What about IVF? Those people spending all that money, you've gone through all the rest of it, now you decided to invest in IVF. You've only got X number of eggs, and once you're done with that, that's it. You need to make sure that you are in absolutely the best state possible to receive the eggs. This is where we step in. This is not something an IVF clinic can really do for many patients. They do a little bit, but we can look at things like your hormones, we look at balancing your nutrition, we look at inflammation generally. Basically, we take a step back and try to figure out how can we make this person the best host possible. What's within their DNA, what's within their body, what's within their blood test. We look at all of that, and we can make it the best possible, so that when the implantation takes place and it's there, you are ready for it. And the other category that we see are unexplained fertility. Infertility, where you have no idea why you can't get pregnant, and maybe IVF is out of your reach, or maybe it is in your reach, but you don't know why you can't get pregnant. Maybe you have already had a child, but now for the second one or the third one, it's just eluding you. You do not know why it's not happening anymore. And this is another category where we can actually take a little look, do a deep dive into it, and try to help you figure out what's going on, so that we can actually do targeted management rather than guessing all the time as to, let's try this for a while. Because when you're at this stage of your fertility journey, time is really not on your side, and we understand that. And therefore, by having targeted testing, targeted management, chances of helping us being able to help you is so much higher.